there are almost 300,000 people in the Medicaid coverage gap in Alabama. We're a small state, a huge chunk without health care coverage, and there's a fix out there. By sharing these stories, that'll move the needle.
We've got another interview lined up here about Medicaid expansion. And this one is really important, especially in light of the news coming out about tens of thousands of Alabamians losing Medicaid. Really the crux of it is for no reason, right? Because there is no reason that they should have to go without insurance, especially when we are contemplating the medical bills for federal prisoners increasing by an estimated $400 million a year.
And we're currently building the most expensive prison,
right?
I think, in the U.S.
Yes.
And it was 2 prisons for $1 billion, I believe. Now it's one prison
for like $1.3 billion.
The BOGO deal busted, and but we can't.
And that's just the medical bills though for prisoners has been revised up to about $400 million more. And the reason that Republicans are always saying, oh, we shouldn't expand Medicaid, we can't expand Medicaid, is because they say, and it's not exactly this, but they say $200 million a year is what it would cost to expand Medicaid. And it's like, well, if you did that, you could throw all the prisoners on Medicaid and you're going to save $200 million right there. I mean, it pays for itself to get Medicaid if you just consider how much it costs to administer healthcare to prisoners without that Medicaid expansion. But then, you're talking about tens of thousands of jobs that would be created. You're talking about, it's really priceless when you think about people not dying because they don't have healthcare.
And it's not like there's not other places in the world that have much more productive workers.
Yeah.
Like, I just always look at Germany because it's a huge economy. Mm-hmm. It's got the same kind of education, very similar culturally. We have a ton of German people that live here, and we work over there and they have these social safety nets, and education and healthcare that support their workers. And lo and behold, their workers are outproducing us hour by hour. Yep. They're getting more stuff done, making more money.
Outproducing us hour by hour, and they work less. The average German worker works 3 months less per year than we do. 3 months. I mean, that's wild.
I'd take that vacation.
Yeah, I mean, good grief. And actually, speaking about the German workers, Unite All Workers for Democracy, which is the Reform Caucus in the UAW, they are doing a webinar with French and German Stellantis workers, talking about workers from those unions about the EV transition and about their 35-hour work weeks. So, it's not really that radical because people in other industrial countries are doing that. It's going to be on Zoom. Follow UAWD on Twitter, and you can find that and you can register for it. I have asked for a recording of that panel so we can play a couple clips next week. So we're going to cross our fingers that they're going to be recording that. I'm not sure if they are, but if they will, then I'll show you some stuff next week. I'm really looking forward to it. But yeah, so I got sidetracked a little bit. Medicaid expansion is important. We should do it. People should have healthcare. Everybody should have healthcare, but particularly folks that can't pay for it through themselves or their employer. And here's a conversation that Adam Keller pre-taped with a organizer with Cover Alabama, which is a coalition dedicated to expanding Medicaid in Alabama. Let's play that interview.
All right, folks, you're still listening to the Valley Labor Report, Alabama's only union talk radio show. Really looking forward to this next interview, talking to a good friend of mine with Cover Alabama. And before I talk to her, I wanted to mention a couple of things about Medicaid expansion. Of course, listeners know I've been very passionate about this topic. It's one that I feel very strongly about, and I think it's just such an important issue for working people here in this state. And I wanted to share just a couple statistics with y'all. And this is the kind of information that Cover Alabama is putting out. Specifically, let's start with Madison County. We're recording right here in Huntsville, Alabama. So let's take a look at Madison County, one of Alabama's, fastest growing counties in the state. Let's see, we have 26,219 adults in Madison County who are currently uninsured. Over 11,000 of those would be eligible for health insurance under expanded Medicaid. Over 11,000. We could reduce the number of uninsured adults in Madison County by 44% with Medicaid expansion. And it's worth noting that almost 1 in 5 in Madison County have medical debt in collections. Almost 1 in 5. And a couple numbers across the state. There's been 14 total hospital closures in Alabama since 2010. Only 13% of women of childbearing age are uninsured in Alabama. It's only 13%, but 13% is 13% too many. Medicaid expansion would gain 20,000 new jobs in Alabama. 20,000 new jobs. And now I hear a lot of politicians brag about economic development when there's a few hundred new jobs, a few thousand new jobs. But Medicaid expansion would create 20,000 new jobs, and it would be across the state, right? From top to bottom, east to west. There would be a $327.7 million additional economic impact in Madison County in year one as a result of closing the Medicaid coverage gap. Over $300 million in economic impact just in Madison County, right? By providing this access to health care, the increased jobs, healthier population, the preventative care, the reduction of medical debt, all of this is a formula for success. And so that's why it's so important that folks speak out on this topic. And so that's why I wanted to bring on Whit from Cover Alabama to talk to us about the work that she's doing and how you can get involved in this fight. So, Whit, welcome to the Valley Labor Report.
Thanks for having me.
Absolutely, absolutely. So let me get you on the screen here because, I'm in the studio by myself right now, and it's always tricky with technology. I'm not a pro by any means. But thank you for joining us. I really appreciate it. And I wanted just to start by introducing yourself and tell us a little bit about you and what got you into this work, and of course, talk to me about your UMWA shirt. Love to see the UMWA camouflage on the Valley Labor Report.
Yeah, I guess I'll start from the beginning. I'm Whit Sides. I live in Birmingham, Alabama, and I'm a coal miner's daughter, so that's where this shirt is from. My dad was a coal miner, both my granddads, most of my uncles, most folks I grew up with. So yeah. And that's my background in labor. But I am now the storyteller for Alabama Arise and for the Cover Alabama campaign. So I collect stories of folks that are in the Medicaid coverage gap.
So yeah, talk to us a little bit more about that, in terms of collecting stories. What does that mean? And what are you doing?
Yeah, so my professional career started out in journalism. And so this is kind of the best of both worlds for me. I get to work in advocacy and journalism at the same time.
Awesome.
So I'm basically a nonprofit healthcare reporter. And so I collect stories of people that are not eligible for Medicaid in our state, but then also don't receive any health benefits from their work or they can't afford private health insurance.
So why is it so important to hear like personal stories, right? Because, I mentioned some statistics, and I'm a statistics kind of guy, but I recognize that that's not for everybody, right? And that's not what impacts everybody, particularly, decision makers that we're trying to influence. So what is it about, people's personal stories and testimonies that's so important?
I think it's just like anything else. People connect to a compelling story sometimes easier than they do numbers. That doesn't mean to say that the numbers in Alabama aren't compelling. Something that I didn't know before I joined Alabama Rise is that there are almost 300,000 people in the Medicaid coverage gap in Alabama. We're a small state. We've got, I don't know, not very many, a million people right now.
Right.
Last time we checked. And so a huge chunk of that 300,000 people are living without health care coverage. And there's a fix out there. So I figured by sharing these stories, putting a face to this issue, then that'll be able to move the needle.
Right. Yeah, absolutely.
Hey, 5 seconds. Just wanted to say that this is only possible because of our donors. If you want to see more of this, then consider donating yourself at tvlr.fm/donate.
And I'm interested in some of the highlights so far of some of these stories that you've collected. Like, who are some of the folks that you've talked to, and what have they shared with you?
Yeah, so I've probably collected, or I've spoken to hundreds of people, but we're able to share the stories of probably 30 to 50 people so far. And they're all over the spectrum. In Alabama, it's nearly impossible to receive Medicaid coverage as a able-bodied adult without expansion. And so the majority of folks I talk with are youngish working adults. And that's anyone from a new mother to I've talked to some older workers too, low-income earners who were facing health struggles. So if I had to pick a story, I think they all have such a huge impact on me because people are sharing, some of the most vulnerable parts of their life. Most recently, Erin Mullins from Summerton, Alabama, that's in Walker County, close to where I grew up. She shared her story of what it was like living in the coverage gap and trying to navigate mental health care. So she was diagnosed with anxiety and panic disorder. And once she rolled off of her father's insurance, she basically had nowhere to go. So something that was easily managed with talk therapy and medication, now she had entered a mental health crisis.
Right.
And she couldn't access any of that. She mentioned that if she were paying out of pocket, it would have been $400 just to see her doctor. So she did that once or twice.
Right. But most people can't do that.
Yeah, right. Especially in your 20s too. She was just starting out as a hairstylist. So she worked in a pretty demanding job. She was on her feet all day. She was in a stressful environment. And so not being able to access mental health care, that was just, not great. So she shared her story with us, and she has gone on to share her story with some other regional outlets lately. And that's part of the most, the most fulfilling thing about my work is that these storytellers can grow into advocates once they learn more about what happened to me? I'm not alone. Right. There are hundreds of thousands of other people in my situation. So Erin has become an advocate, and she's been sharing her story far and wide now. I'm very proud of her. too. She just had a new baby. She just joined with her friend to start a new business, and taking the time to share her story can mean, the difference between someone being able to access care and knowing about their situation and not.
Right. That really is powerful. And I do think about how many people are in her exact situation. And, when we talk about the quote unquote workforce participation crisis in Alabama, and you think about how many people are struggling due to lack of health insurance, lack of health care. They're either uninsured or they're underinsured, and they're just not getting what they need to be successful at whatever they want to do, which, for many of them would include the workforce if it was possible. And so, it's just, hearing stories like that is very powerful, I believe. And I'm curious, like, so far, what's been the reaction to folks, when you've been able to share these stories out? Have you gotten any feedback from people about, what they felt like after they read these?
I think most of the time, after people read their stories, whether it's my friends, family, or our members at Arise, they always tell me, they're like, "Oh, well, that's so heartbreaking." And for me, I kind of see it through a different lens. I see it as Medicaid expansion offers a future to folks like this in the coverage gap. So I choose to, choose positivity. As far as workforce participation, so part of the series that Erin, who I spoke about earlier, she was part of a series called See the Gap that we published. And I spoke to dozens of hairstylists, barbers, and nail technicians in Alabama. And a lot of people don't realize, or they don't often think about, the people that are taking care of them, making them look good. The people that they see all the time don't have health care, can't access affordable care. And so it was a privilege of mine to be able to share those stories, and sharing those stories too I've received so much feedback from people that say, wait, but they work. Hairstylists work, especially, 6 days a week, sometimes 12 hours a day.
Right.
I talked to a nail technician who was a salon manager, and she was always on her feet every day. She was there when it opened. She was there when it closed. And it was my nail salon too. And I had no idea. I had no idea she was facing so much medical debt. She didn't have insurance. She was doing what a lot of our family members and people that we love do, where they will try to treat things that they ought to go to a doctor for at home. So stories like that, I think, are unfortunately relatable. And so it's even that more important that we get them out there.
Wow. Yeah, there's a couple of things that really stuck with me in what you just said there. Like, for one thing, the treating at home, like, that is a very widespread phenomenon. Like, all you gotta do is go on Facebook, right? And you're gonna see some stuff where people are clearly pursuing home remedies and pursuing all sorts of stuff off the internet. And, it's just, it is a heartbreaking thing, but it also, like you said, it's an opportunity, because, like, here's one of these clear-cut solutions and clear-cut policies. I mean, it is a no-brainer. There's a lot of issues out there that are very complicated or potentially divisive, but to me, this is a unifying issue, and the opinion polls even back that up, that a majority of Alabamians, even a majority of Republican voters in Alabama, support expanding Medicaid. And, it's a win-win for everybody involved. These folks, these brothers and sisters, these neighbors of ours, can get the treatment that they need and deserve. They can live a more fulfilling life. They can participate in the workforce. Employers can have, a better time recruiting and retaining a workforce that's healthier. We all benefit as a community from a healthier society. And then there's a massive economic impact of the job creation. the tens of thousands of jobs, the economic activity that's generated. Like I said in the intro, politicians love to brag about economic development, and I hear their numbers are a lot less than what Medicaid expansion brings, right? And a lot of these projects that, whatever you think of them, they're not necessarily creating 20,000 jobs. That's just huge. And so to be able to do something that benefits the economy but grows it from the bottom up and materially helps people in their real day-to-day lives and saves lives, I think that's just so huge. And so I really appreciate the work that you're doing to get those stories out there, because a lot of times, the working poor, they don't have their stories told in the media, not enough. And so it's really important what you're doing. And I wanted to ask, how can folks share their story with you? How can they connect?
Yeah, well, something you said before I give folks the opportunity to share their story with me. Alabama is one of the most restrictive states when it comes to Medicaid eligibility. And so you can be working and, earning $50,000. We all know what that's like to have to split $50,000 over a family of 3 or 4. But that still makes you ineligible for those kind of benefits. So things like that, that's what, inspires me to continue doing what I'm doing. But yeah, folks can share their story with me. I'm on Twitter, X now, whatever you want to call it. I'm at Brightsides, SIDES. Also, you can go to coveralabama.org, click on stories, and you can always find me there.
That's awesome. Yeah. In terms of the coverage gap and just like how restrictive Medicaid is, in 2023, a family of 3 must make less than $4,475 a year. Yeah. A year. Less than $5,000 for a family of 3.
I don't think you can get groceries for a year with that.
That's not livable. That's just not livable. And in 2023, a family of 3 must make at least $24,860 a year to qualify for private insurance, right? So there's all these people stuck in between who are working their tails off, who have kids, who have elderly parents they're taking care of, who have all these different scenarios. They have untreated illnesses, untreated, addictions, whatever the situation may be. All these people who are working hard, and we could help them out. Over half of the people in the coverage gap are currently employed, right? So these are, by and large, the working poor. But even those who are unemployed or not in the labor force, whether they're students or caretakers or retirees, everybody deserves a decent life. Everybody deserves to be healthy and be able to fulfill their potential. And so why not do this? Why not do this and for the state and for our people? I just really, really do believe that Medicaid expansion is one of those issues that brings people together. And I really encourage folks to share your story with WIT. Just get those stories out there and share the series that she's already got out there. Really highly recommend it. I love that you talked to the barbers and the hairstylists. Like you said, kind of an overlooked group of hardworking folks, predominantly women, who are working really hard, often those really long hours on their feet, dealing with chemicals, dealing with customers and all that brings. Frankly, sometimes that can be difficult, and so it's just, it's a shame to think about how many folks out there are working hard like that, but can't go to the doctor, can't get medication that they need. We can do better. Alabama can do better, and we deserve to do better. And I think the more we share our stories and share our stories with each other, in conversation with each other, and build community that can fight back, I think we can do it. So, Whit, did you have any final words now that I'm done with my sermon?
No, that was great. I just wanted to say, you ask about some of the stories that I've received the most feedback about. I've unfortunately had to write stories or share stories of people that have passed away, even in my own life while they were in the coverage gap. So I would encourage people, if you find yourself in that place, you realize you're in the coverage gap, because it can be a new concept for a lot of people. They kind of internalize it as some sort of moral failure when it's not. It's a, systemic failure. But if you realize you're in the coverage gap and you want to share your story, let's do it now. Let's do it now before it's too late. We don't want to lose any more people in the coverage gap, because this issue is life or death,
Absolutely. It's an urgent issue. We've been fighting this fight for way too long. But ultimately, I believe we can win this fight the more of us get involved. So, Whit, thank you so much for your time. Really appreciate it, and thanks for all you're doing to get these stories out there. And again, folks should go to coveralabama.org. Thank you so much.
Thank you.
You just saw a clip from the Valley Labor Report. We are live every Saturday morning from 9:30 a.m. till 12:30 p.m. And we pride ourselves on keeping all of our content free to everybody so that we can talk to as many working folks as possible. If you support the work that we're doing, you think that it's important, you think that it's good, then consider making a monthly contribution to the project, and you can do that on our website, tvlr.fm.